All right.
Yeah.
What?
Hi.
Good morning.
Good morning. We're live.
We are live.
We are live at Amenity Aid here, and it is echoing, so we might want to
This is the volume.
New technology, everyone. This is what happens live on camera. Can't make it up. I think we're good now. All right. So, hi, everyone. James Rajat here. I'm joined today by our founder and executive director, Liz Dugan, and Dr. Philip Chan from Open Door Health. We are very excited to talk with you this morning about health, hygiene, and all things 401 Gives. So I'd love to start by welcoming our viewers and saying thank you for joining both yesterday throughout all of the clips, videos, and asks that we had. You have risen to the challenge. We are hovering around 24,000, so we need that extra push. Many of you saw last night that we are really trying to hit that $50,000 goal today. I want that by 5 p.m. so that we can unlock that $10,000 match to hit that goal. So please keep giving. But let's start today and open the conversation and dialogue this morning as we begin our busy day of activities talking about health and hygiene. So Dr. Chan, why don't you introduce yourself and share a little bit about Open Door Health for our viewers who have no idea what that might be.
Yeah, so good morning, everyone, and thank you, James and Liz, for inviting me, and thank you for all you do in general here at Amenity Aid. So I'm Philip Chan. I'm a physician. I serve as Chief Medical Officer of Open Door Health. Also work part-time for the health department still, where I know James from. But Open Door Health is a community-based clinic that a few of us started in 2020. It's over on Broad Street in Providence. The mission of the clinic is to really help underserved folks in the community. I want to give a shout out to the executive director, Dr. Avi Nunn, my clinical director, Michaela Maynard, and our new medical director, Sapna Chowdhury. So we provide primary care, we provide gender affirming care, obviously important in this day and age.
Absolutely.
We do a lot of sexual health, we do a lot of STI care, HIV care, et cetera.
Excellent. And again, I want to remind viewers that the work that we do at Amenity Aid touches so many different populations, and we see that time and time again. That includes our LGBTQ population, folks who might be homeless, a whole folks who are reintegrating into the community from our correctional facilities, those who are in recovery from substance use and other services, as well as those who are receiving active services to assist with addiction. And I know all of those folks come to your clinic, so we are thrilled to have you here this morning. Liz, as our executive director, you've been in this business for quite some time. And we were able to recently partner together and be on a podcast with Dr. Chan. Why don't you tell folks a little bit about why we wanted to talk about soap, suds, and hygiene?
Oh, so many reasons. So I know from my own research, I hear things like people are brushing their teeth with baking soda because they can't afford toothpaste. They're washing without soap. They're skipping showers. They can't clean their clothes with soap. And a lot of times when people learn what we do, they think a lot about like, oh, they just feel clean, but there really is an effect that happens on people and their health. And I'm wondering if you could shed a light with our viewers about that impact that happens when people are going without these products.
Absolutely. And this is something actually that you both have educated me about a little bit as well. I think the one thing that was very striking to me was that 1 in 3 people in Rhode Island,
30% of household families, yeah.
people have this, and that was new to me. I think really just underscores the importance. And when we talk about public health and health in general, I think the big things often rise to the top. Things like
Yes.
housing, things like job or not having a job, and those things are very important. And we need systems level approaches to address those. But I think sometimes we forget about the smaller things,
Absolutely.
the everyday things.
And that's how I got started. Actually, I came across this need by donating hotel amenities, and everywhere I went, whether it was a senior center or a homeless shelter, they never had enough. And that's when I learned there is no systemic system to capture these people that may have fallen through. You think about food, there's the food bank, and housing, there's a ton of work being done there. But when it comes to hygiene and security, there was really no safety net for organizations or people that need these items.
And I think what's nice is that, when we talk about things like housing, it feels very, it feels like I can't make a huge difference. It's not like I can just buy someone a house, right?
Right.
I think what's cool about what you guys all do and this organization does is, you can buy, a case of shampoo, right? I mean,
Right.
that's affordable, an affordable item that you can donate to people.
Yeah, in fact, if you were to donate $5 every month as a monthly donor, that would give access to 2 packages of pads and tampons for people in need. That's how easy it is to give back to us, $5 a month.
Again, you're hearing from the experts here. I'm just the hype guy this morning, but these are the 2 experts. But I do want to tie a few of these strings together. So, Dr. Chen, having worked with you for so long at the health department in my former life, and specifically having worked on COVID and other things together, certainly we know that there is an effect on individuals and their physical health when they have no access to soap or other sanitation, supplies. And then we've heard in the past from Dr. Schwetzgenbaum and others around how if you can't brush your teeth, that creates gum disease and then creates potential other complications and other chronic diseases. Could you share a little bit with viewers on sort of the clinical reasons or the clinical benefits of having access to hygiene?
Absolutely. I think that there's as you mentioned, the dental aspect. I think we know that brushing your teeth obviously is super important. I think there's a cleanliness aspect, right? And just making sure that you are, as clean as you can be, washing regularly, using soap and other products like that. So there is certainly a health aspect. And then there's also the social, emotional aspect, right? Especially for kids, you don't want to smell, you want to be clean. And certainly if you're not, then that can also have a toll on your social connections and affect someone emotionally and mentally.
Absolutely. And I spoke to one of our partners at Dorcas International yesterday, and Milagro Sike, who is a dear friend of mine as well. She talked about how, to your point around the social anxiety and the social items, that when she was growing up, she was taught how to use lemons and lemon peels as deodorant. And that was her experience. And it burned and it was uncomfortable, but it's what you learned to get by. But how that had an effect on her, and she was open to sharing that yesterday. So I wanted to just add that to sort of the realities of what Rhode Islanders who are in this 38% who cannot afford these supplies may be experiencing there.
Yeah, I mean, these are neighbors in our backyard. The other thing, when I talk to people, they always think it's like somewhere far, far away. And I have to tell them, like, I live in Warwick and I get emails from Warwick Public Schools asking me for pads and tampons. This is in our neighborhood. And just to kind of echo what you both said, it's the ability to fully participate in life. And that is all ages, all ages. So whether it's school, I can share a quick story about someone that came into one of the pantries that we work with, expecting to get food. And he was so happy to get a bar of deodorant because his colleagues started to talk about his hygiene, and he was worried about his friendships and his job because of it. So it really is such a cascading impact that is all based on having access to these basic necessities that are not covered by SNAP or any government assistance.
Absolutely. None of our government assistance programs cover these. Medicaid, Medicare do not cover these as well. And when you think about how they're essential to activities of daily living and daily life and quality, we have ways to go, right? I do want to give a shout out though. I was recently in your clinic and happened to use the restroom, and not only were there condoms and other supplies there, but there were pads, there were tampons, there were these other essentials, and I did take a picture, so I will be posting that better later today, but I have to give you kudos where kudos are due.
Yes.
So inclusive and
Yes.
warmed my heart and soul, so thank you. For those who haven't been,
Mhm.
Open Door Health, wonderful, wonderful services, wonderful, wonderful staff. You can tell by this guy sitting right here. But we are here to celebrate that it's 401 Gives. And I believe you are also fundraising for 401 Gives. So let viewers know why you need support.
Yeah, so Open Door Health is part of an organization called Rhode Island Public Health Institute. It is a nonprofit. It's filled with a lot of good do-gooders, which is one thing that I love about the organization. Similar to you all, right? Very mission value aligned. And we survive in part on donations. So please do consider donating to us as well. We do have a mission that we do provide care to anyone that walks through the door of Open Door Health. So we do bill insurance, we take insurance, we try to bill insurance. That's what it's there for. But at the end of the day, if someone can't pay, we do cover. And we do focus on sexual health, things like HIV, STIs, PrEP, which is a pill that can prevent HIV. So do check us out.
Great. So if you haven't heard of them, Open Door Health, please check them out. 401 Gives, you can find their fundraiser. And Liz, I know we have some lofty goals But one of our goals of hitting that $40,000 before 5 o'clock today is it's your birthday today, and you are turning the big
It
40.
is.
So happy birthday live on
Thank
TV.
you. I'm proud to be 40. I own it. I love it. I made it.
And tell viewers why it's so important to you with Amenity. You often talk to me about how this is your firstborn child. So share with folks the journey.
It's been, I felt so isolated when I first started this in 2013. I was in my garage. It was very much me, my friends and family, couponing, getting products cheap, asking shelters what they need, for showing up to them. And then when I tried to make it more of a sustainable organization, we got a board together, we got our status. It was so difficult. I mean, people got the need, but I couldn't seem to get the larger community around me and that's what you need to be successful in a nonprofit. You need the entire community to back you. So when I sit here, next to Dr. Chan, and we got James as the board chairman in this beautiful facility, it's almost a sense of like, who am I? Like, who's this other person? Because I still think I'm in my garage, like counting on the weekends the number of toiletries. And it was so difficult to get where I am today. I could write a whole book about that, but the challenges of, going up against fundraising challenges, stuff like that, it's so heartwarming to know that I've been a paid employee for 5 years now. And we're now at the point where we have so many people welcoming us and talking about us and acknowledging the work and the need and the fact that we're feeling the need so efficiently in our community that there's really no better birthday gift I could give to myself. In fact, 5 years ago today is when I quit my job and started here full time. So I had a donor text me this morning saying, congratulations, it's your 5-year anniversary at Amenity Aid. You did it, which was wonderful to hear.
So again, viewers, so much impact you can have across our work by thinking about a donation to Amenity Aid today, but you can also support Open Door Health. I have to give kudos to Liz and Dr. Chan because working with them and being on the Public Health Out Loud podcast, if you haven't seen it, look for it online. You can see ours, but a variety of others that are extremely well moderated, so informative and quick to listen to. Because of that, the De Beaumont Foundation reached out to me and they gave me permission to announce that in May, a Getting Practical column focused on personal hygiene insecurity in America will be published with references to the podcast that we did, to Amenity Aid, to really bring awareness to this unspoken crisis. And so I want to say that will be out in May. I will make sure to share it with you all, and you all heard it first here live. And so with that, I'd like to end today, or at least this little segment that we're doing, by sharing that I'm also getting old.
Well, isn't tomorrow an important day for you?
Tomorrow might be my 40th birthday, yes indeed. So you've got two Aries in the house here. But I posted last night and this morning, that my gift to myself this year was not a trip, was not hosting a party for me and all of my friends or anything like that, but putting my money where my mouth is. I'm trying to be very intentional this year. And so I have reached, as of this morning, the $2,500 that I was looking for to match my donation to Amenity Aid. So Liz, you have the 25 from me. But then I have another 3,500, but we're down to about 3,000 or 2,500 to go. That will be going to our partners that we work with or our collaborators of other items, organizations that are important to me. And so I need you all to help me by donating to Amenity Aid, unlock the rest of my $3,000 to go to organizations. And I want to say publicly that 500 of that is going to Open Door Health. So if you can make that happen, you get a 2-for-1 special here. Donate to Amenity Aid, that dollar doubles and goes to Open Door Health.
I just want to thank you, James. I just want to acknowledge you as well. You're one of those people behind the scenes that does so much good work for the state.
Yes.
James works for EOHHS. He's leading tons of initiatives focused on keeping Rhode Islanders healthy. So, and you're also board chair here. So James is really one of those people in our state that behind the scenes really helps a whole lot of people, often unrecognized. So thank you for all you do.
Thank you.
And he leads with his heart.
He does.
I do.
It's very rare to find. We love that about him.
I do.
Mhm.
So with that, we are going to wrap here because we want to give these folks a special tour of the warehouse because they have not seen it. If you haven't seen it, tune in a little bit and you'll get that behind the scene peek too.
Thank you, Dr. Chan, for
Thank
joining
you
us.
so much for joining us this
Thank
morning.
you both for everything you do.
Absolutely.